This presentation has been prepared to you for your understanding of sleep apnea, your condition, as well as both surgical and non-surgical options available for treatment. It also explains what sleep apnea is and what health outcomes may occur if it goes untreated. Sleep apnea is cessation of breathing or reduction of breathing number of times per hour. When this occurs many times, it can lead to significant daytime tiredness and sleepiness, which can lead to road traffic accidents as well as heart attacks or strokes. Essentially, sleep apnea is a medical condition that warrants treatment, whereas mild sleep apnea or snoring is more of a social condition. Should you need to undergo surgery for that, this needs to be carefully considered and discussed with the partner and the surgeon. We invite the partner to attend the clinic for discussion. The reason for sleep apnea is a lack of dilating forces in your airway. This is determined by the bony structure of your jaw and the face, and the integrity or the strength of the soft tissue, which includes the tongue, the tonsils, and the back of the throat. If these structures are not elevated or in the correct position, they can collapse during the deep aspects of the sleep. The aim of the combined sleep clinic meeting is first to look at how severe your sleep apnea is, to undergo a careful assessment of your anatomy, to look at the impact of sleep apnea on you, as well as look at the exact sites of obstruction, then to see if there's any surgically correctable anatomy, as well as to see if there's any non-surgical options that may be suitable for you. Once we find out all of this, you'll be educated on both non-surgical and surgical options, and you will be educated on surgical options should you wish to proceed. The tongue can be extremely enlarged in sleep apnea patients, leading to significant collapse. Some people's tonsils can be extremely enlarged. A procedure called Woodson's hypotonic method is done to look at the degree of tongue base collapse as well as the side wall collapse during sleep. Also, we'll look at the soft tissue collapse to see if it contributes to sleep apnea. All this will be carefully assessed during your preoperative evaluation. Once all information is at hand, you'll be offered CPAP, possible dental devices for jaw movement, as well as positioning device if that is suitable. Should you not wish to proceed with these, surgery can be discussed, as it's a very good option that has evolved over the years. However, surgery does not replace any non-surgical methods that may be suitable to you. Once again, surgery has advanced a lot over the last 25 to 30 years. It can be divided into bony framework surgery. Bony framework surgery is quite extensive, which involves sometimes moving the lower jaw forward and sometimes moving the hyoid bone in the back of the throat where the tongue attaches to. In extreme cases, maxillomandibular advancement is a procedure to move the facial structure forward that also can reduce sleep apnea. That often is done in patients who have got significant facial abnormality by the maxillofacial surgeons. During those procedures, the tongue base collapse can reduce. The other techniques of reducing tongue base involves ultrasound or endoscopic guided tongue resections as well as robotic resections. The soft tissue or the back of the throat can be elevated with various techniques, and these have significantly evolved over the time, particularly with the 2013 presentations by Sydney ENT surgeons, as well as some of the European techniques by an Italian professor called Vicini. These techniques have significantly advanced sleep apnea surgical treatment, and we use a hybrid of these. So essentially, what you understand now is, to improve sleep apnea, we have to lift the soft palate, widen the oral airway, and bring the tongue down. So how do we achieve this, and what do we do? To explain this, I'm going to redraw the back of the throat. That is the soft palate. That is the tongue. Then the tonsils on the side. If you look in the mouth, that's what you should see. The airway that you see would be in the shaded area. But in most sleep apnea patients, the soft palate is very low, hidden behind the tongue. all you see when you look in the mirror opening your mouth may be a big tongue, which leads to significant airway narrowing. So that goes without saying, the correction will involve lifting the soft palate, bringing the tongue, and moving the side walls sideways. How do we achieve that? I'm redrawing the tonsils, the soft palate, and there are two muscles on either side of the tonsil which I've drawn. Further on the side highlighted area is a pterygomandibular raphe between the lower jaw and the upper jaw. Just imagine them like tension wires on the sides of the throat. The surgery involves cutting the front part of the muscle towards these tension wires or the pterygomandibular raphe, removing the tonsils to expose the back muscle behind the tonsil. So that back muscle is also cut. Then it's swung around to anchor into the pterygomandibular raphe, thereby elevating the back throat muscle and anchoring into the soft palate to try and anchor it and give strength by suture techniques as described there. The importance of this is that it'll allow the soft palate to be widened, elevated, and give a fairly square shape look, which assists the opening of the lateral sides or the side walls of the throat. Now, the other important part is to bring the tongue down. And how do we achieve this? We use a technique called the consulation, which is a very gentle technique of melting the tongue tissue to bring the bulk of the tongue and to shrink the tongue tissue. And the predetermined areas are used to reduce damage to the nerves and the blood vessels. On a side view, what you see is the tongue is high riding and the soft palate is hanging low. And with the techniques we use, the tongue will be brought forward and the soft tissue will be elevated or lifted to give a much bigger opening in the back of the throat. And that will allow a significant open airway to try and reduce the sleep apnea that you have. So to quickly discuss a little bit more about tongue channeling, there have been a lot of studies done with thousands of operations to determine the nerves and the blood vessels that run in the tongue and where they run. What we have found is the back of the tongue is generally the safer area for channeling because the nerves and the vessels are further away and they somewhat come to the surface and to the middle as it comes further forward. So when we're channeling, we channel in the middle of the tongue, straight at the back, and when we are channeling the sides, we stay more superficially or more in the surface to reduce any potential damage to the nerves and the blood vessels. Once again, the consulation is a gentle way of melting tongue tissue, and over a 6 to 8 week period, the tongue size will reduce to an extent, improving the collapse at the back of the throat. It is not open resection, therefore generally is not as painful. There are still risks which we will discuss in the second section. So what are our results? With the hybrid technique, we conducted a study at Frankston Hospital and we found a significant reduction in sleep apnea patients. These patients were not just patients with big tonsils, some of them were patients with big tongues, and we found close to a 70% reduction in their apnea and hypopnea index, or in other words, the level of sleep apnea. That was a significant improvement. A later study showed somewhat of a lesser reduction, possibly about 40% reduction. However, their sleepiness improved from a level of 13.9 down to 5.29. That showed the importance of reducing sleepiness, which is the biggest contributor to road traffic accidents. So overall, what we can say is it significantly improves sleep apnea. It's unlikely to cure sleep apnea, but it does give a significantly better outcome for those who cannot tolerate non-surgical methods. The next section will be about the consent process, what to expect pre and post operatively, and how many days you need to take off, etc. Once again, this presentation is to assist you understand your condition and the treatment options available to you, but it does not replace your one-on-one meeting with your surgeon and the physicians. Thank you.